People are multidimensional, and not one health professional can meet all the needs for one particular patient. That's the beauty of working in this area, is that, and in healthcare in general, is that every single patient is different, and we need a team of people, usually, to be able to assist that patient back to the level of health that they were before they came into hospital, and restore them to as much independence as what they possibly can be.
Interprofessional practice is the gold standard of care that we can provide. It's everyone working together, giving the best outcomes for our patients.
It's a lot more satisfying from a job satisfaction point of view. I think there's two elements to it. I think that it lends itself to a positive workplace culture where everybody feels valued and they feel that they have a say and they feel that they're part of a team. And I think from a patient perspective that the healthcare that's delivered to them is more collaborative, and it's more it's delivered in a better time frame because everybody's working together.
Interprofessional practice has changed me in regards to being able to work together with other disciplines on particular projects that I've been involved with.
I can get a perspective from each health professional how that patient is progressing, which gives me an idea of what they're assessing and the things that they might be doing with the patient at that time.
So all our teams are constantly communicating, whether it's on wards or in the outpatient settings, working with each other, talking about our clients with our clients to get things right.
It's something that we don't think about, that is just already embedded in our day-to-day work.
I guess you feel quite good within yourself to see someone achieve something and to know that you've had some sort of impact on that.
It's very enjoyable to work in. Great teams in the workforce are just similar to great teams in the sporting field. They achieve amazing results.
There is still a lot of confusion between the difference of the definition of a multi-professional team and then what is an interprofessional team. Sometimes people use the term interchangeably and they're not the same thing. We do coordinate, we do collaborate, but we only do so at certain times during the week when there's structure. So if it's not a designated meeting, you're probably not going to have a lot of communication with other disciplines. Interprofessional means that we're doing it all the time and it just becomes a standard part of our day that we are coordinating and collaborating with the different people that are involved in a person's care.
You don't have a common goal for the patient care, so care can be very disjointed. It can result in increased length of stay, and ultimately you're not providing the best care for that patient.
And it can be sometimes aimless in the sense that there's no real focus, and it can be disconcerting, I'd imagine, not knowing what's happening or what's going on in the future.
I don't think that the care that we would deliver would be the best that you can get, and I don't think that we'd have a workforce. I think that this model also lends itself to where young people are at, where this current generation is at, that they're collaborative, that they're consultative, that they like to work together. And that's what I think. If I was a young 18-year-old student thinking about what my options were, that would be what would lend me towards healthcare, is the team and the cross-pollination between the disciplines for the same cause.
With interprofessional practice, the goal is about person-centred care. So if the team is unclear about the goal and they're working as individuals, then the team falls apart.
It's the basic, it's the communication skills. If you don't communicate to one another, then you can't achieve any goals at all.
The challenges faced with implementing interprofessional practice are to do with facilitating change. So it requires staff to change how they're normally working. It involves them looking at themselves and saying, what are my strengths, weaknesses? How do I contribute to the team? And looking at others. So it's often about them changing their behaviours.
Not everyone is educated around interprofessional practice, so more education is needed. Not everyone is on board with the term, so we may have some members within the team who are not yet operating that particular way, so that can be a challenge.
Generally, I think change within healthcare, probably in most areas, is seen as a bit difficult. Anything that's different is difficult, and I think that you have to reach a critical mass with people understanding exactly why it is that we're doing this and why it's important, and get buy-in from a lot of different people before you can really see it pick up.
So we have initiatives in place that help staff to educate staff on how to work well in a team so that staff can learn their roles and the roles of others, and how to manage team dynamics and team conflicts so that they can be focused on providing the best person-centred care.
I think it is our duty to nurture the up-and-coming students so that they make great clinicians and actually have really good job satisfaction as well.
You cannot deliver a quality health service if you do not put the patient at the centre of the care. It then has all the other healthcare professionals working for that same goal. That's how the model works. The patient is at the centre of it and everybody works together.
Interprofessional practice is the way of the future. We have to be working this way if we wish to meet the needs of our health system in the future.
I reckon it's not the future, I reckon it should be the present to the future.
If I had one superpower, it'd probably be just to ask people to have an open mind.
The advice I'd give to someone implementing interprofessional practice is that the work involved is well worth it. It results in better patient outcomes and better staff satisfaction, so give it a go.